To the coronavirus outbreak, as you know by now, it has arrived in our own backyard. And Brad, the number of people infected over the weekend jumped dramatically.
Yeah, it really did. I want to show you this map. Take a look. All the states in red now have confirmed cases. 560 patients in total right now. By the way, the death toll doubled over the weekend. Our Kelly Taylor has been following the case of a Kansas woman diagnosed, and that led her to KU Med today. Kelly?
Yeah, Brad, we spoke with doctors here at the University of Kansas Health System. We also talked to the Secretary of Kansas's Health Department. They both say that the woman is doing well and she's here right now getting supportive care. Over the weekend, Governor Laura Kelly announced a woman under 50 had the first confirmed case of coronavirus in Kansas. She was self-quarantined in her home, but has since been admitted into the hospital at KU Med.
Most people are able to probably stay at home and either self-quarantine or self-isolate. However, we always have to be wary that you could progress to needing an upgrade in medical care and even evaluation by medical professionals.
Doctors say symptoms could range from none at all to mild or severe. The woman in question's symptoms reached a level where she needed medical care.
When she went to the hospital, I understand that very appropriately she had a mask on and was taken directly up to the unit. So there's been a minimal amount of exposure and nothing without a mask on the patient.
There's currently no treatment for the coronavirus. Doctors say it's similar to influenza in the sense that it's primarily a respiratory illness spread through respiratory mechanisms. Difference is there's no vaccine to help manage it. So what kind of care is offered to someone admitted into the hospital with COVID-19?
Generally, we're going to offer them respiratory care with oxygen, and if they need any type of antibiotic because we think they have a bacterial infection or something of that nature, it's mostly supportive care. There is no specific treatment for COVID-19 to date.
The woman is isolated in a unit with negative airflow, and doctors say there's no risk to people or patients in the hospital.
This patient is in an environment where the risk of spread is virtually zero. So we're really very safe from that patient.
And while there's only one confirmed case in Kansas, the Secretary of the state's health department says he expects more cases in the future. As of now, KU Med has 38 units that are capable of handling patients with the virus, and they say they can add more if needed. And back here live, the doctors did stress to us that people should not panic, but they should do everything that they can in order to protect themselves. And that means washing hands thoroughly, wiping down surfaces, covering your cough, keeping hands out of eyes, nose, and mouth, and staying home if you're sick. Live here at the University of Kansas Health System, Kelly Taylor, KCTV 5 News.
Yeah, all the things that we should be doing all the time. Kelly, thank you for those good reminders.